Good afternoon. My name is Gail Konzemius. I'm a nurse practitioner in the health service. And today you came to this session to hear about what we have to offer here in health services at St. Thomas. So thanks for coming. If you have any questions along the way, don't hesitate to raise your hand, or you can ask questions at the end of the talk. So the one thing that I want to emphasize in this, is that good health is a key part of academic success. And we really work hard to help your student understand how to take care of themselves and things that they can do along the way. And then if they have problems, we're available to help them kind of navigate any health issues that they may be dealing with. So this is a mission statement for the Center of Wellbeing. And the key points I want you to pull out of there are: we work collaboratively with the students and with other departments here at the university. We really work on preventative education. We kind of want to be on the front end of things and help students understand how to take care of themselves so that we can avoid health problems. And of course, if they happen, then we're going to take good care of them and really try to teach them lifelong skills to take care of themselves. So health services is a part of the Center for Wellbeing. Center for Wellbeing has 4 components to it, and at this point we're all in different locations, but we are very excited about our new location that will happen at the end of fall semester. We're going to be going into one building, and it'll be really nice to be able to collaborate with each other more effectively, and things will be much more efficient and convenient for the student. We're going to talk about health services in more detail in a little bit. Also, a part of the Center for Wellbeing is counseling and psychological services. We have doctoral prepared psychologists and psychologists that are in training for their doctoral degree and master's degree that can work with students. They can schedule appointments and have one-on-one counseling. There's also the option for, there's groups, and the counseling kind of helps them understand what kind of services they would benefit from. So if a student is struggling with depression or stress or anxiety, this is a place they can go and kind of discuss what's going on and help them get back on track. Health promotion, or the Wellness Center, will be a part of the Center for Wellbeing, is a part of the Center for Wellbeing, and it looks at educational opportunities for students that look at nutrition and sleep and social opportunities, and just really taking good care of themselves. And they do it in a lot of fun ways, like having, right there you can see the 5K run that they do in the fall, and other activities during the school year. At one point they were offering cooking classes and just kind of fun things to help the students understand how to kind of stay on track and be healthy. And violence prevention is also a part of the Center for Wellbeing. And actually your student will be involved in doing a module before school even starts on violence prevention, so we can help people be aware of their environment and be safe and take care of themselves. It also offers a resource that if a student is struggling with any concerns, a place they can come and know they can talk about things confidentially and have a resource to navigate situations that might be difficult. So if we look at, this kind of touches on the things that we've been talking about, but prevention and early detection, and then helping students have resources, obviously, to have academic success. And we really work to take a holistic approach. So that means not only if they come in, let's say, with a sore throat, or they're not feeling well, or low energy, we'll look at how's your stress level, are you getting enough sleep, and kind of try to touch on the whole student and things that could be imposing on their ability to stay healthy. We are committed to student health. We are different than outside clinics in the sense that we are in this setting, and a part of what we do in trying to keep the student healthy is also to have them to help build those supports to help them succeed academically. And that's a part of what we're looking at. And obviously this triple aim is definitely to provide quality care that's affordable for the student. One thing that's important for us is to make sure that things are cost effective. And we'll talk about how billing works and all of that. It's just like a regular clinic. But it's important that students have access to health care, and so we really work to avoid any possible roadblocks. And if insurance has a really high deductible, or it's out of state, or things like that, you can work with the business office and find ways to keep it affordable so your student can access health care. So at this point in time, we are located in the lower level of the Brady Residence Hall over by the Athletic Center. And by the end of the semester, we'll be located, it'll be across Summit Avenue, right if they went straight out from the arches. So that's where they'll be able to locate us toward the end of the semester. Our staff consists of a number of specialties. We have our medical director, who is a physician in internal medicine. We have multiple nurse practitioners that have a background of internal medicine, family practice, emergency care, urgent care, so that allows us to provide a number of services. We have psychiatry. Now it's Dr. Godfrey has since retired. Dr. Kim Gateskill is our psychiatrist. So if we have students with more complex mental health issues and we need that kind of expertise, we have a psychiatrist that we can consult. We have a registered nurse who does triage. We have physical therapy that comes every week during the school year and provides physical therapy for our non-athletes. Our athletic department has physical therapy within their facility, but the regular student is still doing things that are athletic and can injure themselves or may have some chronic issues. So we have physical therapy that comes right here to campus. We also have a dietitian who comes every few weeks and can provide dietary management, and that can help with students who are struggling with maybe being underweight, being overweight, eating disorders, just trying to find a healthy diet. They can sit down with the dietitian and get that kind of guidance. So the services that we offer in the health service here at St. Thomas, we have a comprehensive clinic and offer a multitude of services. And I think I'm going to go to the second row there of acute care. That's probably what a lot of people think of when they think about a health service. Within that, we'll cover respiratory illnesses and stomach flu and bladder infections and a variety of things, concussion management. If a student is dehydrated, we will do IV hydration in the clinic, so we don't have to have somebody sit in an emergency room for 6 hours to get rehydrated. We can provide those services there. In regards to concussion management, if somebody comes in with a concussion and it's a concussion that can be managed on an outpatient basis and it doesn't need a specialist, the thing that we will do is we will follow up with the student. So if it's impacting their academics in any way, we can collaborate with the other departments on campus. If there's some academic a bump in the road because it's just hard to focus and everything, we'll work with professors and academic counseling to help the students stay on track and stay on schedule. We also manage chronic illnesses, so we can do things like allergy shots. So if somebody is on allergy shots, rather than have them have to leave campus frequently, every week they can come to health services. We work with the allergist and we get the serum from them. We follow their recommendations. If we have any problems, we collaborate with them so a student can maintain those kind of their allergy shots while they're still on campus. And we can also manage other chronic illnesses. The other thing that we can do is we can work with the primary care provider or the specialist. So some students have illnesses that require routine blood management, or they may need an intramuscular injection once a week. Those are things that we can also work with the specialist. So we will get the orders from the specialist and collaborate with them so the student doesn't have to be leaving campus and using up time and trying to figure out transportation and everything. So we can collaborate with outside healthcare providers. In the first row, we have preventative care, so we do routine physicals, travel physicals, sports physicals. We can do cancer screening. Dr. Votel is certified in dermoscopy, so she's specifically focused on screening for skin cancer. We do preventative health care like flu shot clinics. We work to help routine vaccines, and we also work to help people with students with tobacco cessation. And having been in the college setting for over a decade, 10 years ago, I would ask, about nicotine use, and that's something I routinely ask students: alcohol use and nicotine use, because that's just part of that wellness piece. Rarely did I see our student population smoking cigarettes, but it's changed, and now we have e-cigs and vaping and Juul, and it is amazing coming up from the middle school and high school, seeing the use of these devices, and it's very habit forming. And very addicting because it's nicotine kind of in a high concentration. So it gets its hooks into the user. So we really work to help students be aware of the risks and help recommending they stop, and what can we do to help them do that. So there's an educational component there. We also do mental health. Anxiety and depression is everywhere in our society, and college is no different. So students can struggle with a lot of issues. Some of it's an adjustment disorder, and it's just getting to campus and fitting in and figuring everything out, and it all settles down. But sometimes it can be more chronic. It can be something that they dealt with in their younger years or something that they develop. So we definitely screen for mental health issues. We screen for anxiety and depression. We try to address those issues up front, making it comfortable for the student as we talk about it. We utilize counseling. There's a number of resources in counseling, as I talked about earlier. Sometimes people need medication management. It's what works best for them. Sometimes parents will come in for an appointment, kind of talk about the issues if they're more involved. So there's lots of resources available. Counseling is key, so we really encourage counseling because learning and understanding where they're at is a key part of managing these kind of situations. ADD, ADHD, if somebody comes to us already diagnosed and on medication and can bring documentation, we can help continue their medications as indicated. So if somebody comes through and it's hard for them to get to their regular doctor once a month or every 3 months, that's something that we can work with to help maintain their medications. We don't just make a diagnosis at this stage of life for ADHD, so that may be where they see the psychiatrist or they go through neuropsychiatric screening, but it's not something like I've never had the problem, but now that I'm in college I have ADD. There's a lot of things that can mimic that, like anxiety, so we kind of sort through those pieces. Eating disorders is something that we encounter once again in the population and also in our college population. We do have an eating disorder team, a dietitian and medical and counseling that can work with a student. Obviously, if somebody is more involved, then we will refer and use outside resources or recommend outside resources like the Emily program or Melrose in the Twin Cities or wherever the student is located. I just want to make sure I'm not missing. If anybody has a language barrier, we will engage an interpreter. We'll use that on the phone, so that's a very valuable piece too. One thing I wanted to point out is when it comes to primary care, 60% of our population views us as their primary care clinic. So know that we can serve that purpose. If a student is coming from out of state, they're a distance away, or they're between their pediatrician and wherever they're going to land in life, we can actually act as a primary care provider if that works for the student. So, experts in college health. Why are we experts in college health? What would make us an expert in that? And it's realizing that this is really a stage of life. There's big changes that happen between graduating from high school and graduating from college. And that's something that we're very in tune to, kind of helping them acclimate to college life, and then as they navigate college, how to do that best. We have our fingers on the pulse of the university. We know when finals are, we know when midterms are, we see those adjustment phases. You can see the anxiety level peaking and people are more sick, and then things settle down and they feel better. Being aware of that helps us really take care of them. Coming from the private sector before I got here, I had college students, but I wasn't always tuned into what was actually happening in school at that time, and that really adds a level of how we can take care of them. Also understanding the current issues that may be on campus or in the college setting that can be troublesome. We work with all the on-campus resources, which is a positive component of helping them navigate any maybe chronic problems that they may be struggling with, whether it's mental health or they have their appendix out or they have mono that can be show-stopping sometimes. We can help work with the academic setting, as I said earlier. We are very conscious of the impact that their health can have on their education, and so we really try to work with that piece to keep them on track and keep them in school. And we also work on the community health part of college, which they're in a very communal setting, they live in very close accommodations, and they share everything. So, which includes influenza and things like that. So we really encourage vaccinations are up to date and that they're taking care of themselves and letting them know when there might be an outbreak of something so that they can be on track and taking care of that. And this is just an example, protect the herd. If you've ever heard of herd immunity, if everybody's vaccinated, that protects everybody. And that's what we do with the flu shot. We offer flu clinics so the students can, it actually is offered in this building, and they can easily get their flu shot. We have a number of flu clinics that they can come to, and let's say that doesn't work for them, they can call health services, and they can receive the flu shot there. So when we look at navigating how you utilize the health service, we are student-centered, and so we really try to reach them on the ways that they communicate. And online seems to be, I mean, picking up a phone isn't always necessarily their first instinct, but it certainly is to utilize their phone and to utilize the computer. So it's not uncommon for somebody to be acutely ill and make their appointment at 2 o'clock in the morning, but they can get that appointment in and then come and see us. So we try to be very accessible. We work very hard with acute illnesses for same-day appointments, and we will sometimes double. If somebody comes in sick and needs to be seen that day and our schedule is full, we may double book, or we may rearrange the schedule. If they have had a rash for 3 months, that can wait a few days. Or if they need a physical, that can wait a few days. But if they're acutely sick with fever or dehydration or whatever, we work very hard to get them in, or at least help them navigate what they should do to maintain until we see them, or refer them to outside community resources, which we do have. There's an urgent care in Highland Park and in the area, so really work to help take care of them. We do bill insurance. We are a regular clinic that we take health insurance and bill accordingly, and if there's any co-pays, we can put that on their student account. Once again, as I said before, if we're looking at health insurance issues and high deductibles or coverage that's not in state, we can work with the parent, and we can work with the student on figuring out something that's affordable so there's no roadblocks to health care. Other things that are in the community is we do work with outside specialists, so if somebody needs to have an x-ray, or if somebody needs to have other types of imaging, like an ultrasound or a CT, if we're concerned about something, we do utilize outside radiology, and we will utilize outside specialists like any clinic would. When it comes to pharmacies, oh, yes, sir.
So just, is there a way we can look and see if this is a reporting network or how that whole thing works?
That's a really good question, and you can certainly look on your website with your insurance company and see if it's there. You can also call our clinic and talk to our insurance provider.
Would it just be under University of St. Thomas Clinic?
University of St. Thomas Health Services. So if you go to our website, go to Health Services and the contact number, and I have a business card that I can give you. So you've got the number for the clinic. And if you talk to our insurance person, she can actually get it. Once we have insurance information, we can get into that website and determine if we're in network. Sometimes it's more challenging if it's out of state, or some insurance companies are more challenging, but she can help you navigate that to determine if it's in network or not. But Minnesota's usually not an issue, the major insurances we cover. Within the area, when it comes to pharmacies, if your child needs medications, the closest pharmacy is the CVS on Fairview and Grand. Is about 6 blocks away. We also have and there's multiple pharmacies in the area. We also have a pharmacy called St. Paul Corner Drug that will deliver. So this comes in handy if it's 20 below and somebody needs a prescription, and walking isn't a great idea, and nobody has a car, and mom and dad are 30 miles away. Or if somebody's on a regular prescription that they need filled monthly, this pharmacy will deliver for free. So basically the way we do that is we send them their prescription, their insurance information, and then the student needs to call with a credit card so that any of those co-pays are covered. Yes?
Does CVS have a minute clinic for the weekends? Because you're not open on the weekends.
I do not believe the CVS is as a minute clinic, but there is a urgent care in Highland Park, so that's easy to take the bus to, and that's a Fairview urgent care, and it's on Ford Parkway. And we also have online, if you go to our website, there are resources that for those off hours, so the urgent cares, you can access that information and see what's in the area. Okay? So, in summary, everything that we've touched on, but health is foundational, and the university realizes that it's an integral part of success for our students, whether it's mental health or physical health. And so that's our goal, is to help the students stay on track and be academically successful, and provide them the resources as best we can, or help them access resources. So what can you do as you prepare your student for college? In many, many areas. But when it comes to their health, you know, having that conversation that you probably have had over time, but kind of just touching on, you know, you got to take care of yourself. There's so many opportunities, whether they're social or academic, that can keep you going and going and going, just like high school. And really letting them know, but there's no gatekeeper now. They're their own gatekeeper. So helping them understand that sleep is really valuable. The next talk in here talks about sleep and the value of it. And good nutrition, it's, you know, you stay up late and then you have to get up and get to class and you don't eat breakfast, and then you don't have time for lunch, and you don't eat till dinner, and there's no gas in the tank. So those kind of things, they seem really common sense, but sometimes they don't necessarily click because they're used to being able to push through. Talking about social opportunities and touching on responsible alcohol use and staying in charge of life and not letting things like alcohol take charge. But these can be kind of casual conversations, but sometimes we plant a seed and they hear what you're saying, and hopefully it'll bubble up when there's a situation where they're not feeling well and they're exhausted. It's like, well, yeah, I got 4 hours of sleep for the last 3 nights. Those kind of things that we can work on. And so as they are becoming more and more independent, we can still provide support and help teach them and help them be self-aware. So thank you for coming and listening. And if you have any questions now, I'm happy to answer them. You can always call the clinic and ask questions. The one thing is at this point in time, if your student is 18, they are an adult. And so unlike with the pediatrician, you could call and say what was done and what was the diagnosis. Unless we have a form signed that says your student releases information, we can't have those conversations. It's not, most of the time that's not an issue, and there's times where students will drag out their cell phone, you know, call someone, put it on speaker and say, talk to my parent because I won't remember all this stuff. So it's not uncommon for them to be easily engaged when they're sick. We also want them to know that it is a confidential place that they can come to. So know that your student has a place to come and talk about things. And if they may not want to talk to you about them, you may say, you can go to health services and talk to health services. And it'll be between you and them, but you know that somebody's addressing their concerns. So there's lots of opportunity for things to be addressed. Okay?
Do you have that form so that they can, on your website or anywhere?
It is on our website, yep. So some people will do that in advance and say, you know, discuss with, you know, it's open to discuss with parents health-related issues. So you can go and then send that to us.
Two-part question. First part, so my son's out longboarding, he falls, and he might have broken his wrist.
Mm-hmm.
Do you guys have X-ray machines on the
We do not
grounds, or
have.
he would have to go somewhere
You would
else?
have to go someplace else. So what happens when somebody comes to me with an acute injury like that is I will assess it. And if it looks like I just need to make sure it's not a break, I might send them to the radiologist. They do the film, they contact me with the results. If it looks like an injury that you really need an orthopedic specialist, they've created these beautiful orthopedic urgent cares, then we will direct them to those kind of resources in the community. So we kind of work with what could be the potential problem and you know, provide the best care that we can. But if they need an orthopedic specialist who can do the x-ray and splint it appropriately and everything like that, that's where we'll send them.
On the flip side of it, my son is on the soccer team.
Mm-hmm.
He gets hurt on the field. Is it separate medical for the athlete?
They tend to utilize, they have a sports medicine physician in the athletic center, and that's who they utilize. So they've got that expertise there. They still have to use outside resources for radiology and things like that, but yeah. Okay.
And then I have one other question.
Shoot.
As you're talking about promoting health, if I'm trying to encourage my son to follow a keto diet,
Mm-hmm.
would your youth services have people who could help him navigate that?
That's where I would direct them toward the dietitian, and they could sit down
As
and
part
talk
of your
about things
facility?
as part of our facility. Yeah. Okay, good. All right. Thank you very much.